Hi everybody, I am Ricardo Biffi, Information Technology Consultant at Reply.
And I'm Nils-Christoph Högemann, Senior User Experience Designer at OpenReply and fellow community member of Ricardo in the Community of Practice for Spatial Computing here at Reply, where we also took a look onto the topic of VR in health.
Thank you so much for the invitation to this event. We are happy to have the opportunity to tell you why, for us, virtual reality is a tool that can actually boost our health and treat anxiety, if done in the right way. So, without further ado, let's begin. First of all, let's start off by understanding what anxiety actually is. Anxiety and fears are natural responses of us humans to external threats. They are considered of adaptive origins since the individual who implements them has a greater chance of surviving. Fear prepares the body to react quickly and efficiently to immediately dangerous situations. Anxiety, on the other hand, allows the individual to anticipate potential dangers and also prepares the body to face them.
These two mentioned emotions act on three different levels. First, the behavioral level, where we react to threats, for example moving if a machine gets too close to us. Second, the level of thought, where we anticipate the threat, for example thinking if I do not study I will fail the test. And last but not least, the physiological level, where the body is prepared to face the threat, for example in form of palpitation or sweat. Anxiety and fear manifest themselves during daily activities. Without them, people would act carelessly, for example by approaching dangerous animals or ignoring the work to be done. On the other hand, too strong and continuous presence of anxiety or fear can lower performance or even make a person's life worse. The moment when anxiety and fear are becoming excessive in a context and are continued over time is the moment when they reach the state of pathology and are diagnosed respectively as anxiety disorders and phobias.
It is important to understand that anxiety disorders and phobias are not diseases. They exist inside the range of normal anxiety and fear. They are just an extreme and persistent version of the emotions experienced by everyone. In particular, anxiety and fear become pathological when, first, they are disproportionate to the threat. Second, when they interfere with daily activities. Third, when they induce maladaptive behaviors, for example, distancing or fleeing from the threat. And fourth, when the person is conscious that his anxieties and phobias are unreasonable. But one of the most important criteria for diagnosing an anxiety disorder as pathological is its intrusion into the person's life. For example, an individual who suffers from social phobia but who manages to live his life without problems does not meet the criteria for treatment. However, if the same individual receives a promotion at work that obliges him to give many public presentations, then his social phobia can become a problem that needs treatment.
Mainly there are three factors that keep a person's anxiety disorder alive. First, the behavioral factor. Individuals tend to avoid the stimulus or distract themselves to temporarily reduce anxiety, but in doing so, they cannot realize that anxiety decreases even without resorting to such behaviors and consequently maintain it in the long run. Second, the cognitive factor. Here, anxiety is fueled by negative and unrealistic thoughts. For example, if an individual with social phobia drops a book, he will believe that everyone near him saw what happened and considered him stupid, when probably few have noticed what happened, and those who noticed did not even pay much attention to it. Incorrect thoughts of this type tend to keep the individual in a state of anxiety for longer. Third, the physiological level. At this stage, some physiological factors related to anxiety but caused by other reasons, for example a rapid heartbeat or sweat caused by physical activity, can be misinterpreted by the individual and induce him into a state of anxiety. Often behavioral, cognitive, and physiological factors interact with each other and create a kind of circle that maintains anxiety in the individual.
Now, how are these anxieties traditionally treated in order to effectively help people break this loop? The psychological treatment with the most evidence-supported effectiveness is cognitive behavioral therapy, or CBT for short. CBT is composed of various treatments, among which the main ones are exposure. It consists of exposing the patient to a stimulus that causes him anxiety and repeating the exposure until the anxiety decreases. As simple as that. It is the most used treatment and it brings the best results for anxiety disorders. Then we have psychological education. This education consists of providing the patient with information about the nature of anxiety so that he understands it more in depth. And then we have relaxation. The relaxation consists of teaching the patient breathing techniques to decrease anxiety and calm the physiological response. The goal here is not to treat anxiety in general, but to give a tool to decrease anxiety during stressful situations, for example, during an examination. It consists of helping the patient recognize and face their unrealistic or maladaptive ideas. They receive evidence for and against these thoughts, and they are presented with the actual consequences of their actions or external events, so as to stimulate the patient's rationality. Often patients find it very likely that a negative event will happen and that its effect will be worse than in reality. In these cases, it is effective to show the patient that the likely events are the least serious and that really negative events unlikely happen.
For the behavioral component, modern exposure therapies are based on the theory of emotional processing, which proposes to see structures that contain information about fear stimuli, their responses, and their meaning. The purpose of the exposure is therefore to activate these structures and modify them using new information incompatible with those contained in the structure. Basically, there are 4 different types of exposures. First, the in vivo. In vivo exposures, the individual faces the feared stimulus directly and in reality. For example, a patient who fears snakes may stay in a room with a snake and might even be asked to touch it. This type of exposure is often used for the treatment of specific phobias. Second, the imaginative. In this kind of exposure, the individual faces the feared stimulus with imagination. Usually, this type of exposure is made when the individual is not willing to start with an in vivo exposure, when in vivo exposure is not feasible, or when it's an image or a memory in itself that causes anxiety. Therefore, it is often used to treat post-traumatic stress disorders. Third, the pattern. Here, the individual watches the therapist interact with the feared stimulus. Therefore, it is usually an exposure type which precedes other types of exposures to get patients used to it, so to say. Last but not least, the impediment of the response. In this type of exposure, the individual is exposed to a stimulus that triggers an obsession, and the patient must refrain from assuming compulsive behaviors. For example, a patient with an obsession with contamination must touch objects that he believes are contaminated and then must resist the need to wash.
Now that we know what anxieties are and how they are traditionally treated, how does virtual reality come into play to help us treat these disorders? Well, first, let's have a look at the numbers. You need to know that over 330 million people worldwide suffer from serious anxiety disorders. The COVID-19 pandemic has worsened the situation by adding 76 million cases more. And for those who suffer from anxieties, it implies a significant loss of productivity and emotional suffering. Although traditional treatments such as CBT have ample evidence to support them, the reality is that just 46% of people receive at least one quality pharmacological or psychological treatment, and only 19 to 33% of people receive an in vivo exposure. To better understand what we are talking about, allow me to introduce you to the 5 main factors that trigger most fear reaction as humans. The first is social fears. For example, meeting a stranger, doing a job interview, or public speaking. Then we have the fear of physical wounds, diseases, and death. Then we have the fear of animals such as snakes, birds, insects. Then we have agoraphobic fears that are the fear of open spaces like parking lots or city squares, essentially places where it is difficult to run away from. And the last one is the fear of sexual or aggressive scenes. Here the problem is that traditionally some of them are very hard to organize as an in vivo exposure.
Often this is due to the fact that therapies require economic and temporary resources that not all patients and therapists are willing to support. In vivo exposures, for example, can be challenging to organize. For example, recruiting staff to expose a patient with social anxiety disorder to a social context. embarrassing to execute, for example, leading a patient with an obsession with hygiene into public toilets. Expensive to establish, for example, exposing a patient with flight phobia to a real plane trip. Or even impractical, for example, reviving a traumatic event in Iraq to a soldier with post-traumatic stress disorder. VR is considered an additional and alternative tool to traditional treatments that promises to mitigate the aforementioned problems. In particular, VR is widely used for virtual reality exposure therapy, or in short, VRET. The patient knows that he will have to interact with a simulation of reality, therefore he's more inclined to accept to face difficult situations. From a survey, it appears that 76% of respondents would choose VRET rather than in vivo exposures. And from another survey aimed at university students, up to 89% of respondents prefer VRET over in vivo exposure. Now you might say, hey, yeah, but this is just a simulation. But it is important to highlight that patients think and behave realistically during treatment despite being aware that they are interacting with the simulation. This is also thanks to the fact that our rational thinking is way slower than our heuristic and pattern-based thinking. And here's why VR can make the difference. As VR is the counterpart of the real environment, it is blending off the real physical world completely and replacing it by a synthetic virtual world. The classical treatment of anxieties is more about quantity rather than quality. Even a simple VR solution could do the trick. However, by supporting as many human senses as possible, providing great 3D visuals and spatial sound, we can create highly immersive experiences, which helps patients to not only feel presence, but also behave even more realistically in a given setting. And the more senses we address, beside the visual as well as the auditive system, the more immersive the experience will become. VR haptic gloves or full-body haptic suits like the Tesla suit, for example, could leverage the sense of feeling. Furthermore, hardware like the Tesla suits also provides metrics like the user sweating, their heart rate, and so on, which are coming in handy in this therapy context, as data about every session and situation can easily be collected and saved accordingly. And with all of this immersion, we have a lot of technology in hand in order to make these situations feel very real. This allows us to not only provide the needed quantity, but also quality in such treatments. But do these simulations really have the potential to change something in a patient? I mean, what the patient learns in the simulation, would it also work in real life too? The answer is yes. It is really astonishing what can be accomplished when creating these full immersive experiences. For example, it was found that changing the design or action of a person's avatar may result in changes in user behavior. For example, users who had a black person as their avatar reduced their implicit racial bias, and users who saw an avatar running on a treadmill with a face very similar to their own increased voluntary physical activity. In addition to behavioral changes, users also manifest and altered their perception of their body when their virtual body undergo transformation. So yes, it really has the potential to change something.
And VR is promising not only for exposure therapy, but it can also be used for other purposes in the field of mental health. For example, it could be useful for the evaluation of symptoms. The evaluation is usually carried out in a clinical setting with an interviewer asking questions to the patient, usually asking to recall events that happened a week or a month earlier. However, memory is notoriously misleading, but with VR, on the other hand, it will be possible to evaluate the symptoms on the spot in a standardized and more reliable way. Then we have the correlation of symptoms. By recording the patient's movement and enriching them with eye tracking, heartbeat, skin conductance, and other physiological measures, it could be possible to examine the data collected from the recordings and relate them to the shown symptoms. Then we have the identification of predictive environmental factors. Given the possibility of easily altering the virtual environment, it is possible to study how the symptoms of patients change as particular environmental elements vary. For example, how the level of anxiety of a patient changes depending on the number of visual objects, or the intensity of the background noise, or the size of the room, all of which are variables under our full control. And lastly, the identification of disorders triggers. For the same reasons as the previous point, VR allows us to easily assess when the presence or absence of a factor triggers or not a disorder.
Now, when it comes to the practical application of VR for health, we surely will have some challenges that need to be addressed in order to make it work. The first one is the training of the health personnel. It must be considered that the technology is subject to limitations and malfunctions that can compromise its usage. For example, cyber sickness, difficulty for some devices to work in the dark, or temporary loss of tracking. For these reasons, it is appropriate that there are technically trained personnel in the clinics to solve possible malfunctions and to consciously use the technology. For this, it is important that they do not just know about the technology in general and about the devices, but they rather would also need first-hand experience with such devices in order to have a solid understanding as well as the right level of empathy for the patients.
Already today, when designing digital experiences, there is no real one solution fits all, as we almost always design for a specific context and a specific target group. This also counts for VR. When designing such experiences, we need to remember that patients and clinic settings are not identical. We would need to consider, for example, the clinic's medical procedures and routines, as well as the patient's different age groups, fragility profiles, and level of ability when it comes to interact with the VR experience itself. This, of course, makes the design much more specific and challenging.
Privacy is an important aspect that comes with some serious concerns. Even today, we as users of a given product know that we are heavily being tracked and that big tech companies are gathering millions of data points across platforms about us and our behavior in order to tailor advertising campaigns. Compared to the traditional sites, with VR and hardware that is coupled with it, even more data points are collected, as the technology is changing the nature of our interactions. We are now able to monitor even our biometric data, our movement, our facial expression, and could even have access to what we see and when we look at it via eye tracking, so that we users become even more transparent in these situations. As outlined earlier, this is coming in really handy when it comes to the delivery of high-quality treatments, but also brings two challenges with it, namely privacy concerns, which need to be overcome with ethical and responsible regulations, or existing strict regulations like, for example, the medical confidentiality, like in Germany, should be continued to comply with, and on the other hand, the challenge of organizing and analyzing the data in order to put it into the right use, which can be tackled by AI approaches.
So, in a nutshell, VR has a lot of potential to treat anxiety disorders and phobias if it's done in the right way. VR technology can make therapies accessible to a great audience of patients and at a lower cost. Virtual treatments are easier to distribute and to use than traditional treatments. For example, it is not necessary to set up a clinic and reach it physically to receive treatment. However, despite dropping dramatically in the recent years, the initial cost of VR may still be a potential problem in some clinical settings. In addition to this, you must consider that the technology is subject to limitations and malfunctions that can compromise its use. For example, cyber sickness, the difficulty for some devices to work in the dark, and the temporary loss of tracking. For these reasons, it is appropriate that there is personnel in the clinics who is technically trained, who can solve possible malfunction and can consciously use the technology. Moreover, we will need to tackle the challenges of data handling, as well as designing diverse immersive experiences suited both for particular contexts and specific audience. And to achieve all of this, VR needs us. It needs us to design and develop experiences, to build new hardware devices, and to grow the knowledge base with instructions and trainings for the health sector. We are really excited about what is about to come, and we are happy that we are already investigating extensively in the relevant field within the Reply community of practice for spatial computing. That being said, thanks everybody for your attention and have fun at the event. Bye bye!